Remember, in marketing, we're always looking at trust, confidence, defenses, and resistance. We're always paying attention to this, to our target market. Because what's going to happen if the trust goes down and confidence goes down and defenses goes up and resistance goes up? Do I have a greater likelihood of getting the business or a lot harder likelihood? A lot harder, okay? So here we go. This is the very first and biggest problem in chiropractic right here. Right what we're getting to cover right now, which is the subluxation and chiropractors promoting a subluxation, and they can treat everything because of this thing called a subluxation. So here you have chiropractors talking about autism, treating autism. In 600,000 patient visits a year, do you know how many patients came in to see me because of autism? None. But chiropractors are still going to market it tomorrow, and then they're going to do it again the day after. Do you understand this? It gets to be so pathetically stupid. But they keep going back to their seminars, and they get in their kumbaya circles, and they give their big chant to support what they're doing for another 3 or 4 months, and then they go out and get their ass kicked in the real world. Then they need to go back to another kumbaya session because they just got their ass kicked. Do you know what I mean? You know what I mean, doctors? And then they tell them to do the kumbaya some more, right? It's like inbreeding. It really is. It's like inbreeding. It's that bad. You would think they'd have learned by now after 100 years. Nobody's bought it for... Here's what I always say to these chiropractors that do this. I say, if your retirement account was growing at the rate of chiropractic, 8% after 100, go ahead and divide 8% into 130 years and figure out what kind of growth that is. 0.004, whatever. I said, if your retirement account was growing at the rate of chiropractic, guess what you'd have done to that financial advisor? You'd have fired him. You said, we're changing course because what you're doing's not working. But guess what chiropractors will do tomorrow? They'll talk about autism. How nice does that look that the chiropractor is going to crack that baby's neck?
Depends if you're a mother or not.
What?
Depends if you're a mother or not, or a chiropractor or not.
No, let's talk about the public. Let's talk about...
A lot of, yeah, they would just freak them out.
See, this chiropractor, this is called a proud shot. She posted us on Facebook that she's so proud that she treats babies. She has no idea that say it again? Say it louder.
They'll freak out.
The real world freaks out when they see this stuff. What's it do to trust? Confidence? Defenses? Resistance? And now do you want that chiropractor to even treat your low back pain?
No.
That's why it's crap. That's why these chiropractic stats are in the gutter crap 8%. Because of this kind of stuff. It's like the doctor who pulls out your appendix. It's like we should see the doctors who do appendicitis surgery. He should just have like a picture of him holding up the bloody appendix. I got the appendix from the surgery here. You know, because he's proud he got the appendix. Just stupid. Unbelievably stupid. Cancer prevention workshop by a chiropractor. How do you feel with trust? Confidence? Defenses? Resistance? Do you want to go to him for low back pain, mechanical low back pain, the thing that he's best at now? Do you understand this? The reason I drive this home is the first thing you got to do is stop creating paradigm shifts. Number one, you're not going to get new patients creating paradigm shifts. And secondly, that's the number one reason you'll lose patients, is you'll come in and you do these paradigm shifts because you think it's okay because you're a chiropractor. I'm about to show you something that's going to blow you away. That's chiropractors that are teaching chiropractors how to treat cancer. BeACancerKiller.com. That's true. Have you heard of that site before? That's a practice management group. Chiropractic practice management group that is big on promoting subluxations for everything. Now they're promoting how to treat and help cancer. How much cancer treating experience did you get in chiropractic college? It makes me sick is what it does. It makes me sick of my profession. They're destroying my credibility. Cancer tumor recovery. So they can affect the vagus nerve that determines is the #1 influence in predicting cancer tumor recovery. This is in Tampa. These guys are chiropractors down the street from me. Cancer workshop, you can't see it up there. It says, West Chase Chiropractic Clinic offers cancer workshop. And they're dressed like doctors in their polo shirts, aren't they? Looks like they're ready to hit the golf course. Yeah. Matching, yeah. That makes it all okay now. Yeah. Yeah. Polo shirts. Real professional for doctors. The United States, that's what you expect is a polo shirt from your doctor. And treat cancer. How are you feeling about this? These are the people that it's real with, the CAs. Because they're not in that cult, that chiropractic cult. And what the chiropractors don't know is you're destroying your CAs. You're destroying business and you're destroying your CAs. Now chiropractors are talking about chemtrails. Because we're an authority on chemtrails also. You know, the chemicals the jets leave behind? And typically the people who are bitching about that are the ones flying all over the country. What does a chiropractor not know? That's what I say. What do they not know? Is it sickening or what? It's sickening. It's disgusting. And here's the good news. When you actually are communicating with your patient with normal stuff, like back pain, neck pain, and you're teaching them actually how their body heals, the inflammation phase, and the different therapies that help each phase, they think you're a savior. They love you. Because you're normal. Everything you're saying is like, yeah, that makes total sense. I'm telling you. Just start telling them the truth. And stop doing all this paradigm shift. You will be amazed. Not just the referrals, but your patients, how your patients will respond. That they now trust you. They trust you with what you're saying and doing. And they now trust you with their family members. That, yeah, it's safe to go here. He's a chiropractor. He's one of the good guys, not one of the quacks. You know what I mean? He's one of the normal chiropractors that knows what he's good at, but also knows what he's not damn good at. And not try to be everything to everybody. So, if you have teeth, if your teeth are a priority, you see a dentist. If your life is a priority, you see a chiropractor. This is how they make chiropractors feel a sense of duty about themselves, grandiose. This is how they do it. Chiropractic helps. Hormone imbalance. We go to, you know how many people I had come in my office for hormone imbalance? 600,000 patient visits. How much sense is it to keep promoting something that after 130 years nobody's buying? Then why do you keep doing it? What you don't understand is you're not only not getting business, you're destroying your credibility is what you don't understand. Ear infections or... So, does chiropractic help with these to some degree every now and then? Sure. Your immunity. We go to chiropractors to get our immunity boost all the time, don't we? There was one chiropractor down the street when that HB1 virus came out. It was like 5 years ago. That was the latest Zika thing, you know. Chiropractor had on this billboard, don't get your shot, get your chiropractic adjustment for the HB1 virus. How'd you like, this is just like, He is one proud guy. This is in front of Life College, one of the emblems on campus at Life College. He thinks this is his James Bond shot. This is his I'm cool to my friends shot. I'm getting my atlas adjusted in front of the iconic symbol of Life Chiropractic College. What's that look like to any Joe Blow person on the street? Does that look safe? That look comforting, warm? Looks like you want that? Again, why don't we have the surgeon just show the heart? Right? I ripped the kidney out. Hey, I got it out okay. Here it is. See, this is called stupid, is what this is. He thinks this is macho. He thinks this is macho. What do you think about it?
It's funny. I mean, it's
What do you say? Say it. What?
joke.
Yeah. Can you see how he looks proud? That this is like a proud shot for him?
It's got the equivalent of duck lips.
Of course, we love that immune system. Look, you guys, if you run quick now for $195, you can get the marketing for immunity. How to attract people that want their immunity system boosted. Look, it's only $195, guys. This was on Facebook. Chiropractor posted on there and said, I include this in my report of findings with patients. What do you guys think? Oh, what do they not do? Name a condition that is not on here. Urinary, That's not confusing at all. That doesn't violate trust. Is that increasing your confidence? Oh, I didn't know you could take care of everything. I'm glad you finally told me, because after 130 years, I didn't know that. If we are truly going to change the public perception of chiropractic, we must speak its irrefutable scientific benefits in a way the public can understand. No, the public does not accept things just because you say them. Pizza Hut can make a computer if they wanted to, couldn't they? Does that mean you're going to buy your computer from Pizza Hut? Guess how hard of a marketing problem you'd have explaining the science of Pizza Hut making a good computer. It's called violating the perception of positioning of the human mind. And of course, we have tons of experience in vaccines, and I'm telling you that is one of the primary sources of new patients. They come in wanting to know about how to get vaccines and what vaccines they should take and not take, right? That happens in a chiropractic office all the time, right? And chiropractors are an authority on vaccine. If you're on Facebook, I mean, you always hear vaccines. I mean, it's crazy. Just crazy. Who here thinks a chiropractor is an authority on vaccines? So how do you like it? You go to the dentist for your tooth, and he shows you this chart. And he shows you how these different teeth are connected to your stomach. This tooth's connected to your stomach. This tooth is connected to your kidneys. This tooth is connected to your lungs. And let me teach you some more, because you came in for a tooth problem and tooth pain, but let me teach you how that tooth is connected to your digestive system, and I can help you with your digestive system through your teeth. Are you okay with that?
Not so much.
How big of a paradigm shift is that? What's that doing to trust? What's it doing to confidence? What's it doing to defenses? What's it doing to resistance? What are you doing to that person? You're destroying your credibility.
Is that a real chart?
Yes.
Did you see the element thing on the bottom?
Yes, it's a real chart. Yes, it's a real chart. You go to the ENT doctor, the ears, nose, and throat doctor, because you have an infection, and he starts talking to you about how the ear is related to the intestines and your digestive system, and how he thinks he can help you through the ear with a digestive problem you may be having. Are you okay with that? What just happened to your trust? What just happened to your confidence? What just happened to your defenses? What just happened to your resistance? Do you even want him fooling with your ear infection right now? You go to the hand surgeon because your hand hurts from carpal tunnel pain. And he says, by the way, I can help your thyroid problem. There's a meridian right here in the hand that'll help with your low thyroid count. So you're going to go to him for thyroid problems now. You're going to go to the hand surgeon for thyroid problems now, aren't you? What did he just do to your trust? What did he just do to your confidence? What did he just do to your defenses, resistance? Do you even want him dealing with your hand right now? Do you? You go to the podiatrist and he shows you this chart because you go to the podiatrist for your foot pain. And then when he pulls out, he shows you this chart. And he says, I can help you with your spleen. There's a little meridian right there in your foot that I can help with your digestive and spleen problems and your immune problems relative to your spleen. Okay? Whether you do or don't have spleen problems. You feeling warm and fuzzy right now? You feel like you're enlightened? Or did he just violate your trust? Do you even care? Is that why you're there? Is that why you're spending time or money? You're there for your foot. What did he just do to your confidence? What just happened to the confidence? What just happened to your defenses as a patient? What just happened to your resistance? Do you even want him fooling with your foot right now? Do you want to refer your family members to him now? You go to a massage therapist and she says, oh, I can do massage to help your digestive disorders and improve your immune system. Because that's why we go to a massage therapist, right? Is to increase our immune system, right? So you go for the massage, your muscles. She's talking about your immune system, trying to educate you on that. What'd you just do to your trust? What'd you just do to your confidence, resistance? Do you want to put your clothes back on and get out of there? And then you go to the chiropractor's office for back pain. And then he shows you this chart. And he says, that bone is connected to your digestive system, which you weren't there for. You were there for back pain. What did he just do to your trust? What did he just do to your confidence? What did he just do to your defenses? And what did he just do to your resistance if you're the patient? Do you even want to get treated for back pain now? A little close to home there, wasn't it? I heard you laugh on every other chart. I didn't hear much laughing when we pulled up the chiropractic chart. Did anybody else notice that? I didn't hear much laughing. A little close to home, isn't it? And you all probably have that chart sitting in your office to some degree, and you don't know how you're destroying your business and your credibility, and nobody's coming in for those problems. Any questions about that? So the very first thing you have to stop doing is creating paradigm shifts. If they come in for neck pain, that's what you should be talking about. If they come in for back pain, that's what you should be talking about. And how it heals and how you're going to heal it. And if they don't come in for those reasons, then that's not what you should be talking about, because that's not why they're coming in after 130 years.